I discuss things with a new oncologist. My previous oncologist, I just felt wasn't on board with me as a team. And I felt a little bit like a number. I'm sure a lot of you all can relate to that. And I did feel kind of like I was an island. Hi, this is Leah Hughes, the nurse practitioner here at Mountain Roots Holistic Healthcare. As many of you know, I have been on a long journey with breast cancer and some other health issues. And I feel pretty bad, but I haven't given anybody here in our community an update on how I've been doing. So here it goes. I had my 1-year mammogram in December, at the beginning of December, to check on how things were going. Previously to that, I had been diagnosed with invasive ductal carcinoma of the right breast. I had chosen to have a lumpectomy. I did have 1 lymph node involvement, and I then subsequently did some radiation therapy along with some alternative functional medicine treatments such as high-dose IV vitamin C, ozone, and a lot of anti-inflammatory supplements. After I completed my breast cancer treatment, I also found out that I was living in an apartment that had Stachybotrys, which is a neurotoxic mold, and moved out from there and had been working on detoxing from the mold. The results of the mammogram that I had in December showed a new area that they were concerned with, and also slightly new enlarged lymph node. After discussing my options with my surgeon, we decided to do a biopsy. And one of the good things that came out about that was the lymph node was negative. And the new area was called hyperplagic cell growth. For those of you that don't know what that means, it means that there are abnormal cells, but we don't know what's causing the abnormality. It could be a reoccurrence of my cancer. It could be too early to detect. It could also be changes in the cell from the radiation that I received. The options that I was given was to just monitor and watch it. I also was given the option to have basically a prophylactic mastectomy. I was told often women decide around this time that that's what they want to do because of the not knowing and the waiting can be really stressful emotionally. What I decided to do was I discuss things with a new oncologist. My previous oncologist, I just felt wasn't on board with me as a team. And I felt a little bit like a number. I'm sure a lot of you all can relate to that. And I did feel kind of like I was an island. That was difficult because I'm here for all of you so much. Even though I'm a medical practitioner, I'm pretty human too, and it's hard to make decisions by yourself, and I as well look for a partner in my health to help me navigate the difficulties here. The new oncologist told me about a new study that had come out. This new study is called the Natalee trial. In this trial, they 5,000 women with breast cancer were enrolled in this trial over multiple years. They were given a CK4 inhibitor called ribociclib on top of the standard of care, which was hormone blockers or aromatase inhibitors. This study was done in women that had hormone-positive breast cancer, such as myself, in stage 1A or 2B with lymph node involvement. What they found was ribociclib In addition, reduced reoccurrence rate by 30%. After reading the study and discussing my options, this medicine doesn't come free. It has a lot of the same side effects as some of the other medications out there. I've decided to trial the ribociclib. As many of you know, I'm currently waiting for my medical insurance to approve me getting this medication, and I will let you know how it goes. I also am going to do an mRNA cell-targeted therapy through a company called RGCC. This is something that I do offer at my clinic, and you're welcome to give us a call if you have want to get any more information about it. You can also Google RGCC, and there's lots of scientific literature and studies there that explain the types of therapies that they offer and testing that they offer. So my plan is to start the ribociclib. I will continue on anastrozole, which is a hormone blocking agent, and we will do the RGCC targeted therapy called Q-restraint. I had a MRI that was to give me a baseline, and I also will have a subsequent MRI in 6 months. And we will go from there and see how everything worked. I'm also doing all the regular stuff, trying to eat healthy, stay away from sugar. I'm going to start doing some yoga, which is a great exercise. It's a weight-bearing exercise and also helps with stress, which many of you know, this can be a stressful illness and a stressful disease. Things that I struggle with every day are fatigue and joint pain and stiffness. A lot of that is left over from radiation treatment and also from the aromatase inhibitor medications that I take, and also from just not having any hormones anymore. I still believe in hormones, and I still believe in hormone replacement therapy. So that's my update, and I will try to keep you guys in the loop a little bit better about how things are going. And feel free to reach out to me at info@mountainrootshh.com. My practice is called Mountain Roots Holistic Healthcare. We're here to help you get to the root cause of why you feel the way that you feel. And I'd love to hear your stories and help support you in any way that I can. Thank you for listening.